Welcome back. And now what I'm going to demonstrate to you is the exact same colonoscopy note that I filled out on the last demonstration, but this time I'm going to omit the explanations so that I can show you how quick and easy it can be for a physician who is used to this type of practice to be able to complete their note. So I'm going to continue with the same scenario of a 54-year-old gentleman who is coming for a surveillance colonoscopy after surgery for a right-sided colon cancer. And the only words that I'm going to use from now on are just in order to create the note, and I'm going to omit any explanation. So here we go. This 54-year-old gentleman presents for a surveillance colonoscopy, period. He had a right hemicolectomy 3 years ago for an adenocarcinoma of the colon, period. He did not require any chemotherapy, period. He has been asymptomatic since his surgery, period. In particular, comma, there has been no change in bowel habit, comma, no abdominal pain, comma, and no rectal bleeding, period. His appetite is good and his weight is stable, period. He has no new health conditions since his surgery, comma, with no hospital admissions, period. This 54-year-old gentleman underwent a complete colonoscopy to the terminal ileum for surveillance purposes, period. The only abnormality found was a single short stalk pedunculated polyp in the sigmoid, comma, which was about 5 millimeters in diameter, period. It was successfully removed with an electrocautery snare and retrieved for pathology, period. Pathology results are pending, period. If this is a typical adenoma, comma, then a repeat colonoscopy would be recommended in 5 years, period. If this is a tubulovillous adenoma, then a repeat colonoscopy would be recommended in 3 years, period. If there are any other unusual findings on the pathology, comma, my office will be in contact to arrange an alternate screening interval, period. Many thanks for involving me in the care of your patient, period. Repeat colonoscopy may be required sooner than 5 years depending on pathology results. Okay, and the note is completed now. I'm going to show you the version that the family doctor will see when they receive it in their fax or mail. There is a summary of the pre-procedure components, a little bit of information about the consultation for the patient as well as their medications and previous history, a little bit about their physical examination, the procedure itself, what the findings were, and finally the images showing where the polyp was found, what it looked like, and then finally a summary of the impression and recommendations, the diagnosis given to the patient, and the instructions given to the patient. And I'm going to sign that. In this case, I already created a note earlier with the same diagnosis, so it is warning me that I'm about to duplicate that diagnosis. I'm going to say to use the existing one. And that's it. The note actually would be faxed off to the physician as we speak, and they should receive it in less than a minute.